Hello. So today I wanted to talk about the nuances of being on call. So holding the on-call pager, whether it be that physical pager or if you get your pages forwarded to your phone, having your cell phone always at hand. When I first started taking call, I was really nervous about straying too far from the hospital, maybe not wearing the right thing if I was called in and not necessarily expecting it. And also, what to do with my call bag if I wanted to go do an activity like take a really short hike, which, as you spend longer and longer amounts of time on call, you become more comfortable with incorporating the various activities you like into the days that you're on call. And this is, I think, really important if you're on call over the weekend because we've all got things that we like to do and need to get done. In my case, it's really important for my mental health to be able to go on long bike rides. So, speaking of bike rides and things you might want to do while you're on call, like going to dinner, going to a movie, the really important things to keep in mind are that you always have to, you're obligated to make sure that you are in a cell service rich area. So, no middle of nowhere places where if someone needed to reach you, they can't. And number two, keeping in mind that in ophthalmology, there are a lot of urgent situations and a lot of perhaps things that need to be attended to very quickly, but there are very few true eye care emergencies where, the difference between seeing the patient in 15 minutes versus seeing the patient in 30 minutes can actually have an impact on final visual outcome. For example, if a patient has a retrobulbar hemorrhage leading to compartment syndrome, you need to get in and do a lateral canthotomy, cantholysis as soon as you can. Or if a patient is in acute angle closure glaucoma, you want to make sure you get that eye pressure down as soon as possible, putting on max topical drops, having the patient take Diamox if they don't have any contraindications, no kidney disease, and trying to get that cornea clear so you can perform an LPI, which is the definitive treatment. And sometimes patients are going to eventually need cataract surgery if it's a, phacomorphic glaucoma type situation. But anyway, the point is, you, in most cases, will be okay if you can't get in to see the patient until an hour or two, maybe even more later, maybe the next day. But it is good practice to at least return a page within 10-15 minutes. And when I was in residency, the rule was that you gave someone a good plan or some sort of assessment within an hour, not necessarily go see the patient in an hour, but keeping those lines of communication open. Another thing that I wanted to address was appropriate attire while on call. So, if you're going to be out and about doing things, working out, cycling to Hawk Hill, or going to a nice dinner, you're going to be wearing things that perhaps are not quite kosher to be seeing patients in. And so in my case, I always like to have a pair of backup scrubs in the call room, or if I can fit it in my call bag. And, wearing scrubs on call is, I think, always appropriate, sometimes expected. But wearing scrubs, especially in COVID era and post COVID, out in the wild is, I think, probably no longer going to be acceptable. So, just something to keep in mind. I kind of got over the whole crappy aesthetics of carrying around my call backpack when I'm doing things. And once I got over that, my life became a lot easier because when I was on call, I always had my call stuff with me and I never had to go back home to fetch my supplies. So that saved me a ton of time. That about sums it up. Um, when you're on call, the longer that you take call, the more times you go through it, the more comfortable you're going to get with going out with your call bag, doing different activities, and you'll figure out your preferred method of dealing with calls as they come in. But regardless of what that is, the top thing to remember is to, wherever you are, check to make sure you have a really robust cell signal. Okay, so looking forward to seeing you next time. Bye.